Hello, and thank you for joining us for the Denver Health Foundation's third session of the Springboard series. I'm Crystal Potter Rivera, Associate Executive Director of Denver Health Foundation, and we launched the Springboard series as a way to help our donors learn more about how Denver Health functions as an anchor institution in the community, acting as a springboard for delivering health, social, and economic solutions. The Springboard series brings together a panel of community leaders and Denver Health experts to talk about important community issues and explore ways to tackle those challenges together to create positive systemic change. Often, philanthropy is what makes that work possible, and we're tremendously grateful to you, our donors, for the role you play in that. Today's session will focus on comprehensive approaches to child well-being, and we have great panelists, including Denver Health Chief Executive Officer, Dr. Robin Wittenstein, who I'll ask to introduce the other panelists in just a moment, but first, some housekeeping. One, we are recording this session, and we'll send it out after we're through and also post it on the Foundation's website. Two, all attendees are automatically muted, but we do encourage questions, so please post yours in the Q&A chat box. And three, in addition to questions now, we welcome your questions, input, suggestions on future sessions, so please look for the feedback survey we'll be sending your way. Thanks again for joining us. We really are very honored for your engagement in these important discussions. You are the foundation of Denver's health. I'll turn it over to Robin.
So thank you, Crystal. So I'm really excited for today's topic. We've got a really good panel, and I will introduce them, and then we'll get started. I'll give some framework and background on what we're trying to accomplish. So we have Cassie Leyva, who is with us from the David and Laura Merage Foundation. Cassie has an extensive background in child development and well-being, and really looking at the kinds of issues that affect how children can flourish or not in their environments, and what we can do as a society to help the next generation who really are our future. I know for me, I'm counting on somebody's children helping me, because I'm not sure mine will, but really good background in terms of how we can approach in a very comprehensive way the challenges that we face. Mike Johnston is the president and CEO of the Gary Community Investment Fund. Mike has a background in education, has been a teacher, a principal, has also been involved in public policy through his work in both the Obama administration, as well as serving as a senator in Colorado for 2 terms, and is now leading the Gary Community Investment Fund with a real focus on both child well-being, but also how do we tackle these really big issues that face us as a society, and do so in a way that we can come up with long-term sustainable and impactful solutions. Pia Dean is the chair of the board for the Denver Health and Hospital Authority, a healthcare attorney who had a long career with Holland and Hart, but has also been deeply involved in issues around equity, health equity, for many years, including founding the Medical Legal Partnership of Colorado and the Colorado Health Equity Project. And we really rely a lot on Dean and on Pia, not just for keeping the board straight and keeping me straight, which is a job in and of itself, but really constantly challenging us and focusing on, are we sure that what we're doing is really getting at the issues that are of such significance to some of the most vulnerable people that we serve, and most importantly, how do we solve them? Not just how do we recognize them, but what can we do to solve them? So as a framework for what we're going to talk about today, and Crystal mentioned the child well-being, there are really 2 kinds of work that we are focusing on right now, and they are both very related, and I think the themes and the issues that are included are just so connected. One is around child well-being, and what Denver Health is interested in as an anchor institution is really helping the families in Denver lay the foundation for a more successful future. I have said in many meetings, money is not the solution to every problem, but there are problems for which it is the only solution. And some of those include, if you don't have a place to live or food to feed your children, having money is absolutely the solution. But it goes far beyond that. And what we're trying to do is work on a comprehensive approach to identifying the kinds of barriers and challenges, issues that the families we care for face, and then developing long-term solutions to those, working with people over time. So a very intentional, longitudinal approach to addressing everything from housing and employment, child development activities, housing, whatever it might be, and coming up with an approach to that. The other piece of work is one that we're building off of related to our internal work around our own employees. So we have people who work for Denver Health who are in entry-level positions or sometimes even non-entry level, and they face many of the same social and economic challenges that the patients we care for face. And we are deeply committed to making sure that everybody who is part of Denver Health, whether they are our patients or they are our employees, have the opportunity for a better future. And so we've been thinking about how do we approach that, recognizing that poverty is a problem that can be solved through career pathing, through social supports, through economic supports, in partnership with our community. And many of the kinds of challenges that we've seen our employees talk about and we've seen our patients talk about overlap so significantly that we're really trying to think ahead to how do we bring these buckets of work together and advance. And so what I want to talk about today in particular is these issues have existed for a long time. We've had these challenges for probably as long as any of us have been alive. There are a lot of community organizations and governmental entities and organizations like Denver Health that are interested in tackling these. And yet we don't seem to have quite made the progress I think any of us would hope. Race and ethnicity factor into this, the issues that have been raised through COVID, the disparate impact of economic downturns on people of color has been highlighted. Always has been there, but I think we're finally as a society beginning to recognize that we actually have to deal with this. And so what I'm hoping we can do today is get the answers to all of these questions from our panelists. But really to have a conversation about what is it that we're doing, have done, or should do that could actually make a difference in getting to a solution that is workable. And I will say in a conversation with our dear friend Nancy Gary, we talked about the beauty of setting a vision for what we want to achieve and where we want to go, and then stepping back and saying, oh, we're going to do this one person, one family at a time, and not trying to solve all the world's problems in one fell swoop. I don't think we're going to eliminate poverty this year, but we're certainly going to make progress. So I have a number of questions that I have drafted, and I shared with the panelists ahead of time just to give them some sense of what we're thinking about. And I'd like to just begin opening up the topic. Has Mike been able to join us? Okay, Mike was just delayed a couple of minutes, so he's now joined us. So I'm gonna toss the first question out because I'm really hoping that that there is a good answer to it. And that really is around the question of there are so many organizations, there are so many people who are deeply, deeply committed to this work. And there's a lot of activity, and yet it doesn't feel as if we've quite gotten to where we need to get. And I'm really interested in the thoughts of our panelists about why have we maybe not been able to make the progress we want? What do we need to do differently than we've been doing? So, Mike, you came on last, so I'll jump to you and ask you your thoughts on this. And I'm going to be taking notes. So.
Yes, I should appropriately be picked on for being late, so that is totally fair. Great to see you all. So sorry to be a few minutes late, but delighted to be with you. And thanks so much for all the amazing work that you all are leading at Denver Health on this front. I think one of the challenges is both getting clear about what the problem is that we need to solve and getting clear about it from the eyes of the families and kids who are living through it. So we are not trying to solve a problem that doesn't exist in the lived experience of families. And then the second is one of coordination, is actually setting a clear goal for what we want to accomplish and then making sure that all of our partners are working together on all fronts to accomplish that goal. And I think that means working on policy change, it means working on programmatic change, it means nonprofit partners, it means public partners, it means for-profit partners. And so I think our belief at Gary is that you have to try to coordinate all of those entities and corral them all in the same direction, because oftentimes you have really great entrepreneurs potentially working at adverse impacts themselves. I'll give you one example. Right now, we are really focused on providing universal preschool and making sure every kid gets access to preschool. And when you do preschool, you want to make sure that you provide real high quality preschool. Well, to do that often means you want to reduce the number of kids in a class. You want to increase the training and certification of the teacher that's in that room. And guess what? Those things all drive up costs. So at the same time that we're working on trying to help increase families' income so they can afford to pay their rent and their bills, one of those bills is childcare. And so it could be easy for us to say, if we just went all in on just trying to improve childcare, we could build the best system in Colorado, and it would cost parents $47,000 a year. And that would put all of our parents back in poverty, which is where we're all trying to get them out of. And so I think for us, the challenge is how we all as a constellation here set some ambitious goals, get clear on them, and then figure out how we can work towards them together, both across multiple sectors and across multiple areas of focus. That's what I'm so excited about. This comprehensive focus on poverty as a problem allows us to figure out where we can each play a part without being adverse.
Good. And Cassie, your thoughts?
Yeah, absolutely. I definitely echo Mike's sentiments here. First, just to thank you for pulling these conversations together. I think it really does take getting so many different perspectives from parents and really understanding what those are, but to business leaders, to different nonprofits that are in here trying to tackle it, and really having the conversations is such an essential piece of the coordination effort. I think one of the barriers is really oftentimes programs, and when we talk about poverty, we're talking about the lowest threshold of income earners. And what I really want us to consider is, what is that next threshold? So we often hear, especially in our work with our childcare work, is that we hear that mothers in particular, but parents in general, are just right at that level where if they even get a promotion at work, they have to turn that down. They have to say, I can't take the risk that some people do with their career, because any bit of risk is really detrimental to our family, or I'm going to edge out of that support. So it's a bit of this cliff that families find themselves at. And so when we look at these programs, I would really encourage, and our work really tries to extend that income barrier and look at how these issues, particularly childcare, actually impacts families at all income levels. And that means we can really come together to solve these problems. It's not necessarily that we're solving problems for those who are most vulnerable, but we're solving it with them. And so I think there is enormous economic opportunity in just looking at where those problems are now, and understanding that that investment now saves us money in the long run. We see that investing in children now can save us up to $11 per dollar that we invest, and that's in social justice, that's in reading programs, that's across the board. And so when we look at those first, particularly 0 to 5, those first years of a child's life, and often the most vulnerable that families are financially in those early years, it's really about making sure that we are addressing these issues early, with the understanding that it ultimately is a societal impact, whether you're a taxpayer or you're looking at the greater good, that it really is sort of that ripple effect across society.
I have a follow-up question, and it's, I agree with you that one of the challenges we sometimes find, and maybe it's due to the siloed nature. I mean, there's so many different buckets, and we try to get things to fit into them, but the idea of flexibility around whether it's income levels or as a way of not having everything so black and white so that you have to turn down a promotion. How do we get that built into the thinking, not just of, I mean, into our thinking, but also into the thinking of funders, of governmental agencies? What is the way that, because I don't think anybody would disagree. You know, it's silly to tell somebody you can't get a promotion that can continue to lead you down a really good path because it's going to cost you 20 times more than you're going to get. How do we build that in and sort of get past this mindset that sometimes seems to exist of we're just giving people handouts, and our goal is not to give people handouts, it's to give people a hand up. But how do we change that thinking?
Yeah, I think that's a great question. I think so much of it is the spirit in which you approach the work. I think when you work with entrepreneurs or like maybe in the tech space, they're thinking about user experience. So sometimes I think when we usher programs, we're thinking, you know, oh, there's this, we can connect them with these various different organizations, or, you know, this system is just built in a way that is so cumbersome for families. I think about myself. I'm, you know, college educated, I have access to the internet, I have a full stomach, and these systems are impossible to navigate for myself and my family. So if you take that, you know, and there's so many other complicating factors that I think if we have a bit of a different approach and think about it in terms of, you know, that sort of tech space is, you know, what is the user experience here? And maybe starting from that approach and saying, okay, if I were to use this, what does that look like? And I think listening to those families and understanding their experience is, of course, that first step. But I think it is about really trying new approaches to this work. You know, there is so much room for innovation in this space and so much room for new ideas and new perspectives that I think if we look at some of these other areas, to your point, that often have been seen unrelated or siloed, and to say, you know, what is a different type of approach to really tackling this? And I think in particular, that barrier in terms of accessibility and that barrier in terms of navigation is without a doubt one of the largest pieces of feedback that we hear in our work is, even if there are resources out there, I can't figure out how to get them. I can't figure out how to juggle them. You know, if I have 10 hours of care at a school facility, and then I need to make up the other 30, 40 hours, how am I going to do that in the middle of my shift? How am I going to get from point A to point B? So really looking at that user, you know, kind of family first approach, I think is just one way that we could tackle that particular problem. And we would definitely need to look at many of those problems with kind of a new pair of eyes.
Pia, you're obviously the chair of the board, but you've also been really involved in actually working with individuals and helping to navigate them through. What are your thoughts about, I mean, how do we begin to change some of this thinking?
Well, I very much agree with what both Mike and Cassie have said. And I think that when we're talking about identifying the problem and getting clear on what the problem is, that is a broader education issue for the entire community. I remember probably 6 or 7 years ago, I heard the work of Lauren Taylor. It was the first time I'd heard it, where she came out and she'd done a complete study of healthcare spending and social spending across the world, and made very clear that healthcare spending, while we were spending more than any other country by a lot on healthcare, we had poorer outcomes. And she was able to show that for other developed countries, for every dollar of healthcare they were spending 2 on social services. Where in the United States, for every dollar we were spending on healthcare, we're spending 90 cents. And so we can make the argument that when you combine social spending and healthcare spending, you can make the argument that we're spending about what other countries are, but we're spending it in the wrong places. And so I think that it is essential that we make clear, in building on what Cassie said, people are not thinking in terms of handout versus hand up. They're thinking in terms of we have to change the discussion to this is an investment in our community that pays back over and over and over again. Early childhood education helps that child who becomes an adult throughout their entire lifetime. It helps our entire community. It helps in workforce development. It works in all of these different things. But that takes a very integrated approach. And getting back to this idea that it's going to take a user-friendly system, but it also needs to be a system where we all as a community say, this is in the best interest of all of us, no matter what your economic level is. It really helps if we look at this as our community and what we want our community to be. But then you have to take on housing and education and food, and you have to take on the legal issues that land people into the social justice system. In the medical legal partnership, we've learned that you have to deal with problems in a different way. While we do lots of different services, if someone comes in without access to housing or in a difficult housing situation, sometimes you have to attack it as a income benefits issue. Sometimes you have to, because you can't do very much with our current housing laws. Sometimes you have to approach it as you have to take care of legal status to get that family where they need to be. So I think it's that integrated approach with us all working together.
You know, I think as I've listened to this, two things come up that I would like to explore. One is the idea of the investment and the return. And, you know, even within Denver Health, and I hope we have a mindset and a time frame that isn't that, you know, we're not solving poverty this year. Poverty is a solvable problem, but it's not going to get solved quickly. But part of the issue always comes back to when we're working with, whether it's with government agencies or philanthropists or foundations, how do we balance the investment and the time frame that's needed and yet still be able to show, you know, results and success? Because while there is actually a lot of money available in this country, we are a wealthy country. We're choosing to spend it in certain ways, and if we want to change that, how do we demonstrate that those changes really do end up in long-term benefit to all of us as a society? And I'm particularly interested, given the role both of the Merage Foundation and the Gary Community Investment Fund, how do funders look at that so that we can take a different approach? And, you know, Mike, your thoughts, or Cassie, you know, how do we tackle that?
I'm happy to start, and I'll give it to Cassie. Yeah, I think it is finding the balance between the urgency to deliver outcomes, because I think previously in philanthropy or other public,
your best new smartphone deal. Well, I'm an existing customer, and
Whoops. You're on mute
Mike,
now.
we can't hear you.
can you hear me?
Yeah, now we can.
Yeah, I was getting feedback. I wasn't sure what that was from. Great. So I think in the past there's been a sense of, you know, you just write a check and walk away and hope for the best. And I think now many philanthropists see themselves more as partners in the work, which is our goal is to help provide the resources to help make sure you succeed and actually reach outcomes. And so if that means money, great. If that means political capital, great. If that means policy change, if that means helping you find your right CFO, or, you know, it is almost more like a venture capital model where if you invest in a company, you're invested in them succeeding regardless because you believe in them. And so I think that as a more active role of foundations as partners and focused on outcomes. But then I think the other side of that is, and that requires, I think, for us getting clear on what is the long-term goal. If the long-term goal is to end poverty, well, let's break that down. For us, that actually means, can we get, you know, 100% of families in the metro area above the self-sufficiency standard? So they are not just living at poverty level wages, they're actually living at a wage where they can afford to pay their mortgage, pay their bills, and still take care of their families. And so that's a very clear number. We know we're not gonna get that overnight. And, you know, you can increase that number by, you know, increasing someone's income, by decreasing their rent, by decreasing their childcare costs, you know, by increasing their tax credits. There are many strategies you can use to get there. But for us to say to set an ambitious goal, realize we won't do all of it ourselves. What part are we going to take? What part will Denver Health take? What part will Merage take? Or what parts we work on together? But then even if the goal is 10 or 15 years, can we see ourselves improving over time? Are the strategies working? So if our goal is to get another 150,000 families over the self-sufficiency standard, we're not going to do that in 1 year. But we would hope in 1 year we've gotten 5,000 more over. And if we put a bunch of money and work against it and didn't do that, we should step back and ask ourselves, okay, did that strategy not work? Is there something we could have done better? And so for us, it's like, in education, we would call it an interim assessment. It's like you want to get a sense for how we're doing along the way. And you set the really big, ambitious goal, but give yourself time to get there, but hold yourself accountable to what the metrics would be along the way to know we're at least on the right track. Because it's also possible we know we're going to fail a lot. And it's okay to try some things that won't work. And there's no harm in saying, all right, we thought this strategy would work, but it didn't. And so it's a good time to pivot. So I think that's for us the balance of urgency towards outcomes with long-term goals, with the idea of incremental progress towards those we can point to prove that we're on the right track.
Yeah,
Cassie?
Mike, I love that you bring up venture philanthropy. That is definitely David and Laura's model. And so at the Merage Foundations, and particularly Care for All Children, it really is about not just integrating philanthropic dollars, which we know sometimes offers more flexibility, more support for high risk but high reward types of projects, but also this idea of really layering that business expertise that a lot of philanthropic supporters have, right? They've run successful businesses. They've run, they even just at the simplest level, they've been an employer perhaps. And so I think it really is about tapping into some of these areas that just in the past felt like they were, outside of the problem, but really we see that these are so interwoven, right? It's just like you brought up the example of universal pre-K is, okay, well then what about transportation? What about rent? What about all of these things? And it's, you really can't tackle one without addressing the other. And so I think that ability to really look across maybe some of these specialties, and really using the business community as a way to spark ideas, to spark that innovation, to say, this way has worked, and there is definitely a spirit that, all progress is good progress, right? We don't want to undermine that. Making an impact on one child or one family is absolutely meaningful and has that community effect. But I think it is also about thinking big and being able to say, like, this is something that we've never tackled in this way, but we're really going to address this maybe in a more in less of a early childhood kind of traditional format, but more in with this entrepreneurial spirit. And I think when we think about of course business business owners, entrepreneurs are in the philanthropic space, but we also want to remember that so many of these business owners are also parents, they also have their own challenges. They, to Mike's point, there's a lot of tactics that employers can really support their employees. They can be leaders in this space, take advantage of dependent savings accounts, or other things in there. We've seen co-ops where businesses come together to offer their employees care, or bus fares and those sort of things, right? Ways to really address that for their employees. And so I really applaud Denver Health for really thinking about the fact that their employees are often facing similar challenges as the community. And, this idea that even your highest income earner is probably facing these issues, particularly with childcare. We see childcare functioning almost exclusively 8 to 5. And
Yeah.
sometimes not even that, sometimes it's 9 to 2, right? And so how are you supposed to be, mentally at work, feeling good about where your child is, and then present, and then, not taking sick days, not taking all of those things that disrupt your economic trajectory. So I think one thing that we really celebrate in our work is the infiltration of the business community in those solutions, and really just leaving space to be innovative.
One of the questions I have is how much does organizational ego get in the way of some of this? Because there really is a lot of, again, there are a lot of really good organizations that are involved in some of these issues, and Denver Health has very deliberately and intentionally adopted the anchor institution framework, and how we hire, how we spend money, how we invest in our community. But how do we avoid, or do you see ways that we can really avoid this sense of, and I call it organizational ego, and I suspect we're as subject to it as anybody else, but where it's almost as if we've got the solution. I mean, I personally don't think we have the solution. I think there are a lot of folks out there who we need sitting around the table to help us, but it feels to me that some of the siloing that we see and the duplicative efforts is due to the fact that it's hard for organizations, just like I suppose it's hard for people, to look at something and to see all the others who might be even better than we are. And I know, Pia, you've seen a lot of this as you deal with different organizations on the behalf of your clients. How can we get past that? Because I don't know that I care who gets credit for what gets done. I just want to know that it's done. But it doesn't always feel like, even inside our own organization, I'm not picking outside of Denver Health only, it just feels like that sometimes is one of the biggest barriers we've got.
I really do think that we experience a lot of it. People get territorial, right, about what they do. And I think the important part is to focus on what you do well, what your particular organization does well, and then figure out who to partner with to accomplish other things. If we really want to get to the social determinants of health, which we do, if we really want to get to those issues, we have to accept that health isn't just the provision of healthcare. It's the provision of all of these other things. And so it's important to bring the people that are really good at those other things around the table and say, we're not trying to control. We don't want to control. We want you to handle. I mean, Food Bank of the Rockies, Denver Public Schools, the very people that we're sitting here with today, all know what they're doing in terms of childhood education and mental health and those kinds of things. We have to start making really meaningful partnerships. And partnerships are hard. They're relational, they are hard to build, and they are critical to the success. I don't think that we're going to make a difference to our community where we're getting at all of these issues, whether it be transportation or early education or anything else, until we are all sitting around the same table. And I hope that our funders and those who are interested in philanthropic efforts will hold us to that. I think that donors have a lot of say in sort of saying, we want the right people around the table, and put your ego away.
And how do we bring the business community along with us? I'll start by saying, Denver Health has relationships with lots of really prominent business leaders in Denver, and I don't see, well, actually, I have said this to a number of people, Denver is unique. Denver, I've lived in many different cities and places, and Denver is absolutely unique in my mind, because when you talk to people in leadership positions in the city of Denver, whether they're in community organizations or business or government, there is a commitment to solving these problems that I haven't seen in other places, a real commitment. Everybody says it, but here people actually mean it. But part of the question, though, still is, given all of the pressures that businesses face every day, business leaders, and particularly now with the economic situation that we're facing, how do we bring business leaders in as partners, because the work is going to benefit all of us if we really and truly believe that. So, and again, I don't know the answer except one at a time, having conversations, but are there things we ought to be thinking about differently to have a bigger coalition of people sitting around the table?
I think workforce goes a long ways in that. I think that Um, I was born and raised in Denver. I love Denver. I worry that we are going the way that San Francisco's gone or New York City has gone. And that is the people who work in the city can't afford to live in the city. And I think that one of the ways to bring business community along is to sort of say, this is your workforce of the future, right? In all of the things that means. Whether that means the hotel and restaurant industry, whether that means high tech, it doesn't matter. We need all of that. We also need people to live where they work, and they need to be able to afford to live where they work and be a vibrant part of the community.
Yeah, I wholeheartedly agree with that. I think one of the biggest pieces that we really need to consider is what are the value add to businesses. So I think oftentimes when we talk about poverty, it's a morality conversation. And I'm not saying that that doesn't play a role, but I think oftentimes when we're talking with business leaders, they, if they're selling a product, they're used to seeing data. They're used to seeing, it's a little bit more clear cut. Are we successful? Are we not? And sometimes our work is really hard to measure. And I think a commitment to that data is extremely important. But I think it's also about shaping the narrative. So, shaping a narrative that says, just like you pointed out, is that this is the workforce of the future. And, or even now, this is your workforce now. What are you, what happens when families can't work? What does that mean for your business? And I don't think that it's about businesses only thinking about their bottom line or only thinking about themselves. I don't think that's true at all, but I do think that it is about shaping a narrative that relates to their expertise and to their day-to-day lives. And I think, it's not necessarily about always measuring everything in a perfect graph, but I think it is about some of that accountability. I think it is about really committing to showing that these methods work, or that our that these strategies are showing progress. And I think oftentimes, nonprofits or organizations doing this work, that is sort of the first thing to go with funding or with strapped resources. It's like we're really focused on impact, and of course, there's value in that. But if we're not going back and saying, this is why it matters, and this is the context, and this is the context for your community or your particular business, people are busy and they're not making those connections. So I really want to highlight the fact that it is important for us to shift on those narratives and to think about who it is we're talking to, who it is we're trying to bring along, and meet them where they are, and speak in a way that is not, condemning an entire industry, but instead is saying, this is what's successful. Let's come together. This is where we can show our progress, those sort of things. And I think that commitment to data, and really taking the time to build that narrative is essential, particularly for the business world.
Yeah, it's a powerful point, Robin. I think the mistake we make is, to build a movement, you need to make a specific ask of people that fits with their capacity and their skills. And we need to make that ask specific. So I'll give you an example. Like in the 80s, right, being an environmentalist meant you were in the Arctic Ocean, like strapping yourselves to the back of whales to make sure that whaling vessels didn't come and murder them, right? And so when I, as a 10-year-old watching that, I was like, wow, those people are crazy. That's probably not something I'm a part of. When being an environmentalist became, hey, those 6-pack plastic rings in your trash can, birds get stuck in them. Can you cut them up before you throw them away? I did that all day long, right? That was like, okay. Well, now being an environmentalist is, can you put the paper into the green basket and the trash into the other basket? Like that is an activity every day that reinforces my belonging and my membership in the environmental movement. Like I that's a task that's right for me. And so I think business is the same way, right? We can say, they can say, oh gosh, yeah, childcare is a problem. We wish that that would be solved. And us saying you should solve it. I think that I think that there's a simplicity on the near side of complexity and a simplicity on the far side of complexity. And you want to get to the simplicity on the far side, which is when you understand the depth of the problem to know what the simple solutions are. Then it is saying, okay, we know what we're trying to solve on childcare. We're trying to solve cost. We're trying to solve accessibility, and we're trying to solve quality. And so what we need is, we need you businesses to open up childcare facilities within your building. We need you to offer 20 seats, and any employer that has 100 employees or more, and we will give you, Cassie can help find you the right provider, the right partner, the right curriculum, but we need you to dedicate 2,000 square feet on your campus to childcare. That's what we're asking you to do. Everyone do it. That's now a specific actionable item that a business could do. And if they do it, great. You're on board. You're part of the family. We want you to be in the coalition at the table. We'll get it done. If you don't, that's okay too. But you give them sort of a bar they can hit that's within their capacity and within their skills that lets them take an active role. And I think sometimes we don't get to the spot where we know enough about how to solve the problem and we know what the specific ask is to make of the specific partner, and that lets them off the hook. And so it takes a lot of work to get to that right ask, but I feel like if I walk into a room of partners and I don't know what to ask them, it means I haven't done the work to figure out how to solve the problem well enough to know what to ask them.
That's really interesting, because one of the things that I try to get at when we have these conversations is sort of what are the challenges or the issues that are going to get in the way of us being able to get to where we want to, and some of the things that I picked up, I think certainly making sure that we've got the voice of people who are actually experiencing the problems, and otherwise we're coming up with what sometimes feel like very academic solutions. They sound good, but they're not really going to get to the issue, because much like trying to sign up for some of the governmental programs that people are eligible for, it almost becomes, it makes sense to the person who designs the form, but the person has to sit down and try to fill it out when their kid is crying. It doesn't work. I really like the idea of connecting to the values that people and organizations hold, because it's true. I don't think there's anybody that we could possibly talk to who thinks poverty is a good thing, but how do we connect that to the values that they hold and that they're trying to advance? This idea of balancing the short and long term, the vision for what can be, along with what we can do now. But I really like that idea of good asks. And I sometimes feel that way. I sit down and I sit down in front of people, or they sit in front of me, and I'm really not sure exactly what it is that I want to get out of that. But there are things they could do that would be the equivalent of cutting up the six-pack. And if we can put those asks out there, I think we can build on them. That's really interesting.
Agreed.
So I guess the question is, again, lots of good intentions. I don't think resources are the issue. I think that there are enough resources, whether it's money or intellectual capital. They're there. The question is the infrastructure and the way we're approaching it doesn't seem to be designed to really optimize what's in front of us. So we're using everything at maybe less than its best value. What are the pieces of infrastructure that are missing? I think Pia's comment about partnerships. That's one of the biggest pieces. Without those really strong partnerships, I'm afraid we're just doomed to do the same thing over and over again. But what else is missing, particularly as you think about some of the kinds of projects that these two foundations have funded, the things that have gone well and the things where maybe it hasn't gone as well as you'd like? What have been the missing pieces? Because my intent is that we will make brand new mistakes that nobody's ever made rather than the ones people have made. Mike, I think you're on mute.
Cassie, do you want to start?
Go ahead, you can go.
Yeah, the mistakes session is a much longer webinar. As you know, Robin. That would take a lot more time.
I was thinking, like, where do we start?
Yeah, I think there are a couple of different types. I think there are mistakes we've made where we didn't understand the problem well enough when we started, and we were pushing or pulling on the wrong side of it. I think there are mistakes where we didn't, as you said, Robin, listen to the people who were directly experiencing it enough, and so we designed the wrong solution they didn't want to use anyway. I think there were places when we thought we could solve all of it ourselves and didn't bring enough people to the table. And I think there were scenarios where we deferred too much to other outside partners who had investment in the status quo, and we weren't willing to say, we're going to do this our own way if you don't want to be a part of it. And so, yeah, I feel like we've made almost all the types of mistakes in different versions. I don't know how helpful that is to you, other than to say, I think if anything, I think what we found is we can, I'll tell you what we learned maybe from our COVID check platform, on which Denver Health was a great partner, where we just said, we think people want to have access to asymptomatic testing for COVID, even if they have not been exposed early on. And particularly as someone like a kindergarten teacher, if you're going to ask her to go back to school with 30 kids in a classroom or 15, she's probably going to want more than a mask. She's probably going to want some sort of regular testing. And it was in July of 2020, it was a crazy time, and it was very hard to get a hold of testing. There were shortage of laboratories. And that was a very hard thing for the state or the city to do at that point, because they were triaging with the highest need populations. And so we talked for a while about doing it together, and both of them said, we're just not in a position where we think we can do it now. And that was a choice where we would have said, okay, no problem, we won't do it. In that instance, we said instead, totally understand that this is not the top on your radar right now, because you have bigger problems like people dying in senior citizen homes. You should totally do that. But why don't we then just work on this problem on our own, see if we can figure it out. We made tons of mistakes. As you said, we failed fast for 3 or 4 months, found all the things that didn't work. Then by the time we found a system that did work 2 or 3 months later and it was up and running, we could come back to those partners and say, hey, we have this system now, it works. Do you want to partner? They said, great, we'd love to, let's do it together. So in those places, the right combination of listening and collaborating, and then when they say, you know what, we can't do this right now, but if you want to go ahead, our ability to go ahead and make some mistakes where no one cares if we screw things up. If the mayor or the governor screw something up, much bigger risk for them. And so I think our ability to learn fast, make mistakes, and then give those learnings back to the broader public actors has been a place where I think we've been able to help.
Great.
Yeah, I would really echo the space to fail, right? Like we, of course, I love the spirit of we're not going to create the same mistakes, but the reality is innovation and that sort of sweet spot is surrounded by failure. And I think a lot of institutions don't feel like they can take that on, whether that's for their donors or for their, stockholders or whatever that looks like. And I think there has to be a healthy attitude towards trying things and seeing what sticks. In our work, and in particular with childcare, I think we wholeheartedly are seeing that one size does not fit all. And we really want to encourage that no door is a wrong door for a family, is this idea of this the opportunity for families to come in multiple different areas, to engage with resources at various different points, in their lives where they're already naturally occurring, and meeting families where they are. If they have to stretch so far to seek these resources or to be a part of programs, for so many reasons that they're not going to be a part of it. But that's the same with our partners. That's the same with these projects, is if they're just too far from where people are. We want to be visionary, but we want to be realistic about where we are and where those capacities, where those niche skills are, align those people and bring them along. And along the way, report on that and show the data and shape that narrative far and wide. And to your point about ego, that, there is a role for branding. There are these institutions like Denver Health that people respect and that people feel safe, and there is some role in that. But to be mindful that some of this work might be better for, a small, nonprofit or a foundation like ours, because we can take on more risk, we can take on more ability. And so I think it really is about that sort of blended approach, which is more complicated, takes longer, it's not easy, but one size fits all doesn't work. And even though it's easier, we're going to pay for it later. We're going to be fixing it later. So I really love that idea of sort of a healthy relationship with risk.
Well, I think the good news is, one advantage we have is that I am a deeply flawed human being, so I'm used to failure. So, we can live with that. But I just like to give, we're almost out of time, but I want to give Pia a chance because, again, I think Denver Health adopting this framework and really looking at these problems as something that we're not trying to solve by ourselves, but we need to be part of the solution, reflects an amazing commitment on the part of the board. And really, I think it would be helpful to just hear your thoughts on why this is something the board wants to do. Why is this important?
It's a very simple answer. The only way that we get to community health and population health is to take on the social determinants and to take on these social issues. We can't be successful as healthcare providers in making patients healthy when they don't have food, when they don't have a home, when they don't have the very things that they need. And so I think it's the most exciting thing that the board is dealing with. There is huge excitement at the board level on the anchor institution concept, but it's really the idea of to improve the health of a community, we've got to get to these other factors.
So I want to say thank you. Thank you both Mike and Cassie and Pia, but also to everybody who's participating, because I think, this really and truly is something that will take both the scope and size and power of organizations like Denver Health, but also takes every single individual who is involved, who lives, works, or plays in Denver. It's really all of us. I do think these are solvable problems. And, I'm deeply grateful for the fact that we have so many partners and so many people that, as I talk to and we say, we want to try to eliminate poverty, a pretty reasonable response would be to just laugh. But that's not what happens in the city. And people are standing up and saying, yeah, we want to do that too. And it means the world, because we have no chance of success if we try to do this by ourselves. But if we try to do this with all the people who have said, yeah, let's try, there's no question in my mind that we will be successful. So I want to say thank you to, we've got staff members and faculty on, as well as community representatives, donors. It really will take all of us to get at this. And I just, I am amazed at the commitment and how much people want to roll up their sleeves and work. So I just want to say thank you. We will get this solved. But we will make, I promise to both, to you, Cassie, and to you, Mike, we will bring you brand new failures and mistakes that you have never seen before. I promise we will not disappoint you. But we will learn from those. So thank you, and thank you to everybody who participated. I've got tons of notes, and I've got every time I walk out of one of these sessions, some of what we're doing changes based on the conversation. I think that makes it better every time. So thank you so much.
Thanks for your incredible leadership in this space. We're honored to get to be partners.
Thanks.
Absolutely. Yes. Thank you. And thank you for everybody who joined. Just being a part of this conversation and the willingness to learn is essential. These are societal issues that we all play a part in solving and learning about and all of that. And I'm just honored to be alongside Denver Health and everybody here on this call today.
Thank you.